Okay, the scapula. This is the axial skeleton, and this is the appendicular skeleton. Axial skeleton contains ribs, sternum, and the skull. Appendicular skeleton contains which are movable bones. Axial skeleton or the fixed bones, and appendicular skeleton means movable bones. So upper limb and lower limb are in appendicular skeleton, and joints formed by the scapula. So what is the scapula? It is also known as the shoulder bone, and the scapula it is a Latin word which means that it is a shoulder blade. In the large flat, you can see here it is a large flat irregular bone, sorry, and present posteriorly and laterally and superiorly. So it is between the two ribs, second and seventh ribs. It's between the second and seventh ribs. Always remember this. And this one is the glenohumeral joint, which form between the humerus and the scapula. And this is the acromioclavicular joint, as I say in the clavicle lecture in my previous video. This is the acromial process of the scapula, and this is the lateral end of the clavicle. This is the lateral bone. This is the clavicle bone. So it forms the acromioclavicular joint, and this forms the glenohumeral joint. So means scapula forms two joints, glenohumeral joint and the acromioclavicular joint. Glenohumeral joint is also known as the shoulder joint. So comes border of the scapula. So this is the superior border. It is the superior border, and this is the lateral border. This is the lateral, and this is the medial, which is okay. This is the medial border, which is near to the midline. It is known as the medial border, and which is far from the midline. It is known as the lateral border, and superior means upper. And this is okay. And next, scapula. This is the acromion process of the scapula, and this one is the coracoid process. You can see here, this is the coracoid process, and this one is the known as the spine of the scapula because shaped as a spine. Okay. In acromion, this is known as the acromion process of the scapula. It articulates with the lateral end of the clavicle. Okay, this all area is known as the subscapular fossa. Here, subscapulous muscle attaches. And anterior view of scapula. This is the scapular notch, and this is the superior angle, as we can see, as we have. Okay, this is this is the subscapular fossa, and this is the vertebral and medial border, and this is the inferior, and this is the lateral border, and this is the glenoid, and this is the coracoid process, and this is the acromion process. You can also remember here it is as a ACG. First is the acromion, and second is C, means the coracoid process, and third one is the glenoid cavity. So ACG will help you to remember these three bony features. So these all are the bony features of the scapula. Okay, this is the right anterior view, यानी कि right scapula and the anterior view of the right scapula. So comes on the side determination. So glenoid cavity, as we can see that glenoid cavity has to be on the left side. Okay, and subscapular fossa should face anteriorly, and the inferior conoid angle should face downward. So these are the points. So guess you what is the side? Which side is the bone? So it is the which side? Okay, see, glenoid cavity is laterally. Okay, inferior angle is inferior. Okay, inferior angle is inferior. We cannot see subscapular fossa. Subscapular fossa is the back on the scapula, यानी कि back on the scapula, anterior portion. That's why it is the left-sided bone. Means कि left side scapula it is. Okay, now tell which side it is. It is, you can see here, glenoid cavity laterally, inferior angle inferiorly, and we can see subscapular fossa. So it's the anterior view. So how subscapula is always present in anterior. So that's why it is the right-sided bone, because glenoid cavity here you can see, and this is the acromion, and this is the superior angle, and this is the medial border, and this is the lateral border. Okay, and this is the anterior view of the scapula, and this is the posterior view. You can differentiate it by in a simple way. That's superior in the anterior view of the scapula.